Stepchild and Family Center. I'm here today to provide you with an update to the outbreak that is currently happening at Step by Step. For those of you who are not aware, there are 2 outbreaks in 2 different classrooms, and we have positive cases as well in other classrooms, so that brings us to 11 positive cases currently. In a building that has approximately 200 people on a daily basis, it was determined that the best way moving forward was to have everyone tested within our center. So that has been happening over the course of the week. We were really hoping to be opened today. Unfortunately, we're still missing, or we were missing 48 attestations or updates from parents of children, as all of our staff have been tested, and we've received all but 1 back, and they're all negative. But for the children, in order to put the pieces of the puzzle together, in order to have a better understanding of where everything is throughout the entire center, we need those answers. So this last evening, we sent emails out to the 48 families. And today we made phone calls. We tried to follow up. We did receive a good majority of them back, and we're still having about 26 outstanding. So until we can get that information and provide it to public health, so together we can determine where we're at in the situation, and if it's safe to open, then we will do so. So I'm hoping that the families will reach back out to us, that they will get their children tested. It is so important, even if you feel that your child was not in contact with someone, even if your child is not having symptoms, please, if you could, it'll really help us to put the pieces of the puzzle together so that we can safely open on Monday, because the goal of all of this is just so that we can contain the outbreak. We know there's going to be some positive cases. We just want to keep everyone safe. Nyawagoa, Onegiwahi.
Thank you, Nathalie. So public health is working very closely with Step by Step with Nathalie and her team so that we can reopen Step by Step as quickly as possible. And I just wanted to give a little bit of an update about the way that public health works and the reason why we moved towards this closure. It's a bit unusual because we've had cases in schools before, and this is the first time that we've had such a big reaction. So really the 2 classrooms, again, as Nathalie mentioned, there are more cases than we've seen before in a particular area, and having so many cases in those 2 classrooms does indicate an outbreak. And it was really important to us to get a better picture of what was happening in Step by Step, all of Step by Step in all of the classrooms, so that we can determine whether there had been a spread from those 2 classrooms into other classrooms. Of course, there are many measures at Step by Step that all of the educators and the administration is very, very strict about, but it doesn't change the fact that we have children and we don't always have masks on, and there is a possibility of mass transmission. And as Nathalie mentioned, the most important part was to keep the whole environment, all of the employees and all of the children, as safe as possible. But by doing so, we're also protecting the families at home, the grandparents who take care of these children, and all of the friends. And so it was especially important, knowing all of the connections within the community, that we get an appropriate picture of what was happening within the daycare to make good decisions. So that brings us to the testing that was required of all the children. It's very difficult. Many of these children have been tested several times since the beginning of the pandemic, and this is very hard. It's hard for families, it's hard for the children, it's hard for everybody involved. The reason why we require that testing is, again, to get a better picture. It's to be able to make better decisions about how we need to function, how long we need to be closed for, whether there are additional cases, are those additional cases linked to the 2 classes that are already closed? Are they separate cases? All of these questions require answers that allow us to make better decisions about how we move forward. And that's why we need your children to be tested. Otherwise, we're unable to piece together the puzzle, and then our decisions may not be accurate, they may not be reliable, and they may not protect your children and your families. So that's why it's really important that everyone be tested before they return to school. And we're hoping to have that information so that we can make a decision by Friday about what happens next week. So I just want to go a little bit to vaccination rates, because a lot of people have been asking us, what are our vaccination rates? We've been continuously vaccinating, and people are curious to know where we're at with our vaccination rates. So I'll just give you an update about that, and we hope to post something early, either by the end of this week or early next week. So interestingly enough, we've started vaccinating the 5 to 11-year-olds, and we've calculated there are about 650 children of that age group, and we've already vaccinated 15.3%. This is a good number. People are hesitant, and that makes sense. We understand. Some parents are also waiting to see how vaccines go, and we have not had any adverse effects up till now, and we continue to vaccinate 5 to 11-year-olds. For 2 doses, 12 to 15-year-olds are at 74.2%. 2 doses, 16 to 17-year-olds, we're at 82.6%. 2 doses, 18 plus, we're at 71.7%. So we are inching up on vaccinations, and that is a good thing, because we do feel that vaccinations are the best way for self-protection against severe illness and death, of course. We are also giving boosters right now for 70 and over, for those people who have had 2 doses, and for those people whose second dose was at least 6 months ago. And of those all of the 70 plus individuals who have received 2 doses up till now, 53% of them have received a 3rd dose. So we feel that it's very important to give those boosters. We feel that it will add an extra level of protection, and the data is demonstrating that as well, especially because that age group and those people who are immunocompromised have less of an immune response to the vaccine, and therefore it has been established that the boosters can add that extra level of protection against COVID-19's more serious effects and impacts. So just a reminder that we do have vaccination clinics tomorrow and Saturday. We put out a press release yesterday with some change in hours, so I'm just going to repeat to you what those hours are. So for those people who want boosters, who are 70 and over, whose second dose was at least 6 months prior, either Moderna or Pfizer, we have clinics available Friday, December 3rd from 12 p.m. to 8 p.m. and Saturday, December 4th from 9 a.m. to 12 p.m. So that's Friday afternoon, Saturday morning, and you can walk in. You don't need an appointment. However, you can make an appointment by going to Click Santé from the Kahnawake 911 Facebook page. We're also administering doses for 5 to 11-year-olds. Of course, that you must be accompanied by a parent who is going to sign consent. And those appointments are Saturday, December 4th from 1 to 4:30. And again, you can walk in or you can make an appointment. We don't like to mix appointment times between the elders and the children, because we know that children are not vaccinated. We know that there's a potential that someone could have COVID, and we really want to try to keep both groups separate as much as possible so that we don't transmit COVID within the vaccination site. So vaccinations available for walk-ins, and we know that that works very well, so please don't be shy. You can walk in at any time at those times that I mentioned. So The last thing that we want to give an update on is our number of cases. So as you know, since last Sunday, we've had a sharp increase in cases, which was quite alarming, more because of the amount of new cases at once and the, I guess, the stress that put on the public health team to be able to respond. I always go back to the point that we need to identify cases, contact trace, and isolate where required within 24 to 48 hours max in order to contain mass transmission. This is very important. So if there are cases that we don't know about, if there are people being tested in private clinics and then don't advise us of a positive result, we're unable to protect the community the way that we should be protecting them. And if there are many cases all at once and we're unable to respond, then that makes it very difficult to contain transmission. So public health is on top of the situation right now. We were able to respond very quickly considering the amount of cases that we had. And we feel that although we're still at a high level of risk, we feel that the situation is under control and that we should start to see a drop in active cases over the coming days, although we still think that there could be some additional, but then a drop off. So at the present time, we have 29 active cases, and all of these cases are still related to the 4 original clusters of cases that we have been speaking about for the last few days. So we still have about 60 people or so in isolation. We don't have those exact numbers, but it's about 60 people or so. And we are seeing family members of children, for example, becoming positive, and this is normal. This is, again, what's expected, and it's positive news that we're staying within these 4 clusters. So total, we still consider this the 4th wave. We've had 181 active cases since the beginning of the 4th wave, which was mid-July for us. And total in the pandemic, we've had 315 cases. So we do see that we have many more cases than in this wave than we've had before, which makes sense because we're living our lives a little bit differently than we did at the beginning of the pandemic. So as long as we keep this under control and people understand the risk and make decisions for their own safety and their family's safety, then that's a good thing. And I believe that public health, the schools, the daycare, all of you as families are making appropriate decisions in order for us to get control of this current outbreak and mitigate and minimize the amount of risk for all involved. So good job on that. So in the distribution, I thought it interesting just to point out in the 4th wave that 65 of those 181 cases have been within the 0 to 9-year-old age group. 25, 10 to 19, 24, 20 to 29, 31 cases, 30 to 39, 12 cases, 40 to 49, 9, 50 to 59, 10, 60 to 69, 4, 70 to 79. And I'm really, really happy to say that there have been 0 active cases in the 4th wave for 80 to 80-year-olds and over, which means that we are still doing a really good job of protecting our elders. So congratulations on that. The last thing that I wanted to bring up, and this is not at all COVID related, but KMHC related. KMHC this week has been undergoing a very big week. It's called Accreditation. Accreditation Canada is a federal or Canadian body that goes into health institutions and assesses quality of services based on over 1,000 norms and standards. They have been with us all week. All of our teams have been evaluated from housekeeping and cleanliness to quality, risk management, patient safety, to our episodes of care, home care, outpatient, inpatient. Everything was turned over with a fine-tooth comb, and actually were analyzed based on 1,016 standards that were applicable to us in our hospital. And we received an unofficial, because we still will receive an official report in 2 weeks, but an unofficial report of 98.82%. That is incredible. It's an excellence, a level of excellence, actually. And I just wanted to take the opportunity to thank all of you who are users and who, many of you gave your feedback to the accreditors, participated in surveys, and also, again, and especially a huge thank you to the employees of KMHC. All of you were a huge part of this success. You give of yourselves 110% in everything you do, despite the fact that you're exhausted and working your butts off. So thank you to all, to staff, to management, and to our board of directors for having participated in this accreditation process, and really such wonderful results. So congratulations.
Thank you very much, Lisa. Thank you, Nathalie, for your updates. I also want to extend my congratulations to the KMHC staff, management, and board of directors for getting 98% plus on an accreditation. That's the great news for our entire community. But Lisa mentioned it's not necessarily COVID related, which is true. But however, you know, by them having such an excellent standard and 98% plus, it just shows that the healthcare in our community is top notch. The work that's being done at Kateri Hospital, including the public health team, is you know, beyond reproach. It's top notch. So I think that has a impact on the way, from a COVID perspective, the way we respond, and it shows that things are being done properly and done very excellent. So it does touch on that as well. We do remain in a red level alert. As the previous speakers talked about, things are under control. Things have stabilized, but we are still at a significant risk. And so we have to obviously remain cautious, remain vigilant, and make sure that we you know, don't put down our guard, because there, you know, the risk is still there. And as we've seen from last week, it just takes a matter of a couple of days that the situation could turn around. We did a Facebook Live just last week. We talked about you know, remaining in yellow for the holiday season, up until the holiday season, but then it's a matter of time, and we changed to red. And we will remain in a red level alert for at least the next couple of weeks. Things will continue to be evaluated. We will assess as we go. But we don't foresee any significant changes in the next couple of weeks, given the current level of risk and what we are currently dealing with as well. Just a couple of points I also want to touch on. I'm sure, as it's been front page news and top stories on every news that you watch, whether it be American or Canadian, and such, about the Omicron variant, which is emerged out of the South African region, and now is, you know, gradually spreading throughout the world, and it certainly is alarming, and it is being watched very closely internationally, you know, and there's scientists working on this, you know, 24/7 to really get a good picture on what is happening with this variant. And no, I mean, obviously some of the big questions there still is not answers to. Mainly the big questions is it more transmissible than the Delta? We know it certainly is transmissible or highly transmissible, but is it more transmissible than the Delta? You know, those are answers that still have to be forthcoming, and there's work being done, you know, as we speak around the world. No, is it more deadly? You know, that's again another major question, and we get asked here, you know, with some emails, and public health gets asked, but we don't have these answers either. But we know that you know, it's being worked on, and also the vaccination. Is the vaccine going to be effective against this new variant? Indications preliminary on that, is still advisable for everybody to be vaccinated, because even if somebody does contract COVID, whether it be a variant or not, and is vaccinated, the chances of being seriously ill or death is greatly reduced. So again, vaccination remains key. But as things evolve, as they develop, obviously the news is important, but what we'll try to do here is sift through some of the headlines and through our updates on a weekly basis, give you some information on what's happening. But it's, again, I raise that not for certainly no sense of panic, but it's a matter of concern and for people to address make decisions accordingly. One of those decisions, as I'm sure you're aware also, is there's many travel restrictions that have been reimposed over the past few days. Whether it be leaving Canada, leaving US, or internationally, there's much more restrictions that have come into play. So certainly, if you are planning to travel, be very mindful of what is required of you. And that may require testing before you leave and when you return, and it may also include some level of isolation. So check very closely with the U.S. Authorities and Canadian authorities before you do travel. Just noteworthy, from a public health, public safety perspective, from Kahnawake perspective, at this point in time, there is no restrictions imposed upon travel. However, we're asking people to obviously remain vigilant and remain careful. Because we did also, you look around the world, some of the numbers of COVID in general, throughout the U.S., for example, are some of the highest numbers this week since early on in the summer. Same thing for areas of Europe and certainly South Africa. So we got to be careful. Also in Quebec, the past few days have shown some significantly higher numbers than we've seen in the past several weeks and several months. Once again, not to alarm anybody, but again, adjust your behaviors appropriately and take those extra precautions and to try to keep yourself and your family safe. Maybe just a couple other notes I wanted to touch on is regarding some of the testing that takes place over at the Kateri Memorial Hospital, where they do the nose swab or the throat swab. It's the PCR testing. Which that's been the standard throughout the entire pandemic, and it is the hallmark, I guess, of testing. That is the definitive test. Is what's called the PCR test. I know more and more now there is these rapid tests that are being utilized within schools and certain areas and private clinics and such for detecting COVID. But keep in mind, these rapid tests are not a diagnostic tool. They're not the final definitive response. They are definitely useful in certain settings, and they are useful as a tool amongst masking, amongst distancing, amongst hygiene to help get a handle on certain things. But they don't reach that level of a PCR test. So when asked to be tested with a PCR test, it is definitely advisable to go to KMHC site or other sites that do PCR testing. That way, you could be sure that your result is accurate. Because the PCR test is, as I said, it's good, but it's not as accurate as a nasal swab. If you look at it this way, one is a kit that's used, and the other one goes to a scientific lab. So obviously the one within the lab is much more sensitive, much more diagnostic, and much more accurate. So again, I just wanted to make sure that people are aware of that, because it is an important piece of the puzzle as we continue to move through this pandemic. We're going to continue monitoring, watching as we go. We're hopeful in the next few weeks we'll see those numbers going down. We'll reassess the level of alert. We'll reassess measures that are in place. At this point, there is no measures that are being contemplated to be increased. But that, again, as I said last time we spoke, is a day-to-day assessment. And as long as things remain manageable and controllable, we will get there, and we will get there together safely. Nyawa, onigawahi.